almost seems to me like it's kind of fruitless, the masks.
I think I'm going to be wearing it forever.
It makes me yawn a lot because I think it's starving me for oxygen.
It's really hard for me to wear the mask because it's so hot. I have some breathing issues and I really can't breathe with the mask.
I would walk around and yawn about 150 times while I was in there.
If you can go to somewhere private, nobody's around, and just take it out, take a deep breath, that's a good thing.
It fogs up my glasses and I can't see, and I find it really annoying.
I get annoyed with myself when I do forget. I'm like, what's wrong with you? Because it's just like natural. I should have it on. I'm still smelling under the mask.
I feel like I'm really not educated, and I try to be informed.
But with a COVID positive patient, I wear the N95, which is a little bit more form-fitting.
I wear this one, which clings to your face more. I believe this one, on top of this one, will block stuff before it gets to this one.
And if I was sick and I had symptoms, I probably wouldn't even come in the store anyway. I might stick a mask on, just out of what little bit it's going to do to spread.
Hello and welcome again to another episode of What's Your View? I'm Sumayyah Simone, and I'm sitting here with my beautiful co-host, Dr. Sheila Ealey, and we are welcoming with us today Dr. Avery Jackson, who's a neurosurgeon. Dr. Jackson, will you tell us a little bit about your background?
Sure. Well, thanks for having me. So I'm a neurosurgeon, so I do brain and spine surgery. I've been in practice for almost 20 years. I've done about 10,000 surgeries, and I've seen roughly about 100,000 people in my career. And it started when I was 8. I asked the Lord, how could I help people who have brain problems? And my grandmother had a stroke back then, and my mom's mom. And that's why I asked. And so I heard not a voice, but inside him say, I want you to be a neurosurgeon. Had no idea what a neurosurgeon was. I don't have anyone in my family who is in medicine. So I looked up neurosurgery, neurosurgeon, and I said, okay, Lord, I'll do it. And so ever since then, that was my pretty much my goal in life. And then at the age of 12, became born again at Word of Faith International Christian Center with Keith Butler, who's been my spiritual dad now for 42 years, roughly. And then that led to, even though there were challenges, I went to University of Chicago undergrad, then Wayne State for medical school, Northwestern for my general surgery internship, Penn State for neurosurgery residency, and a complex spine fellowship at the Medical College of Wisconsin in Milwaukee. And then from there, I went initially into private practice in Winchester, Virginia. Then a job opened in Michigan. So I took it because it's from my hometown. And I was employed for about a year and a half. And then I bought the practice. So it's been my private practice since 2004.
What an impressive
Wow, that's
resume.
impressive. Yeah.
Thank you.
Dr. Jackson, we're inundated with information. First, Fauci says there's no need to wear masks. They haven't been proven effective. Then he says, no, we need the masks. Now we're hearing that President Biden is paying millions of dollars for the N95 masks to distribute freely to everyone. And we still have mask mandates across the country, not only for children in school, but in the workplace, at the airports, on the airplanes. And we need to have a really good conversation about these masks, and who better to introduce the truth to us than you.
Well, thanks for having me regarding the masks. I'll tell you, one of the things I was sharing earlier is, as a neurosurgeon, and I do a lot of trauma, brain hemorrhages, tumor surgery. And so one of the things that we learn early on fundamentally in neurosurgery and back in the residency is about manipulating carbon dioxide levels. And so we know that we exhale carbon dioxide, and that's our waste product. But for plants, that's kind of their oxygen, if you will. And so they'll take that in, and vice versa. They give us their waste product, which is oxygen. And so right there, just that fundamental understanding of carbon dioxide, you can kind of get a sense that's extremely important. Take it a step further, and the way that we were made in a God-given way is we know that when you exhale your carbon dioxide levels, what happens is when you breathe it out, that you actually shrink your blood vessels in your brain. And the opposite can happen is when you are exposed to too much carbon dioxide, then the blood vessels in your brain expand. So what does that have to do with anything? Well, so there is the Monroe-Kelly doctrine that states that basically there are three components within the skull, which is, say, a box. There's going to be the blood or the blood vessels. There's going to be the spinal fluid and the brain tissue. So when there's a mass lesion, in other words, there's a tumor or there's a hemorrhage, there's blood from, say, an accident or fall, and there's bleeding, and now that's expanding and that's causing pressure, what we have to do is try to eliminate or to give more room in the skull before we can, to help save the patient. And oftentimes we need to do that as we're prepping the person to get them to the operating room, to take off the skull, to evacuate the hemorrhage, stop the bleeding, or to take out the tumor, which could be life-saving. So one of the things that we do as neurosurgeons always is we have them hyperventilate. So when they breathe really quickly, which we can easily do when we put them on the breathing tube, they will blow off their carbon dioxide levels, and that shrinks the blood vessels, giving more room in the skull. So likewise, when there is a buildup of carbon dioxide, those blood vessels will dilate. That's just kind of how they work, and they're very sensitive to carbon dioxide. So now what happens? Well, when they dilate, like for instance, if you have a barrier in front of a person's nose and mouth, like a mask or any other barrier, then that causes the blood vessels to dilate. That causes headaches. It can cause even a seizure-like activity in the brain. And I'm quoting two studies here. One is from Woodbury et al., and it's the Department of Pharmacology, University of Utah College of Medicine. And they looked at the effects of carbon dioxide on brain excitability and electrolytes. And just in a nutshell, they found that when there's increased carbon dioxide that is inhaled, depending upon the concentration, whether it's small, medium, or moderate, you can go on to have decreased brain excitability, which can cause an anesthetic effect. This was in the rat, the developing brain of the rat model. And one of the things, and it affects their intracellular activity and leads to an acidosis, or it actually leads to destruction of the cells in the brain. There's another quick study that was by Carey et al., and that was in biotechnique and histochemistry. And that the title of that study was Effects on Carbon Dioxide Exposure of Early Brain Development in Rats. And this was done at the Mayo Clinic in Jacksonville. And what they found was kind of a similar thing, but they literally saw that each part of the brain had an effect, a negative effect, when it was exposed to more carbon dioxide. And it actually said it affected memory. And the insulin-like growth factor, IGF-1, was also affected and played a major role in early development of the brain itself. So they found that the hippocampus, which is the part of the brain that deals with memory, was injured, and that with exposed more prolonged exposure of this carbon dioxide over time, that the kids, for instance, or anyone can go on and develop not only an anesthetic, so they lose attention, they become more irritable, they become more somnolent, like they're sleepy. And then when you take off the mask and they normalize their carbon dioxide levels and O2 levels, they can actually go on to develop seizure activity, which was noted in these two studies. And then there's a third study that is at Southwest University by Zhu et al., and that was in the Journal of Cerebral Blood Flow Metabolism 2011. And what they demonstrated was they did a really extensive study that was actually in 3 parts. And they were looking at cerebral metabolism, so just the basic functioning of the brain, the carbon dioxide inhalation that we just mentioned. And also they looked at the EEG and how the brain activity was manipulated or changed or affected by carbon dioxide. And in a nutshell, they found out that everything that I just mentioned to you in the first 2 studies that were not in the adult or in the human also occurred. And so the dysfunction was real across all of those different tests. So the effect on the brain itself and on metabolism in general, the entire body, was significantly affected. And so the other thing that we know that when you have a mask over the mouth and the nose, that it causes that, right? And then the other argument on the other side would be, well, but we want to curb, a virus, and so that's why we want to wear this mask. But here's the interesting thing: if you take a look at Dr. Petty's work, and you look at aerosolized particles are not, they're so small, they're not trapped by a mask or a shield. And an aerosolized particle would be like the virus, right? And that they actually go through all those masks. But the thing is that aerosolized particles are manipulated by airflow. And the interesting study, I know that you all were mentioning about, traveling.
Yes.
And if I could just mention, Dr. Petty himself, who is an industrial hygienist, he's got a bunch of patents. He's done a lot of work with OSHA. He was getting ready to go on a plane one day. And so he said, well, I'm concerned, if there's a virus issue here, so I'm going to wear a true respirator. So it fit perfectly around his face. It was like the Darth Vader type scenario. Yes. And he was going to protect himself truly from a virus and then protect others. He goes up to the counter and the lady tells him, or the person who's representative says, well, what do you have on? He says, I'm an industrial hygienist, which means this is my specialty. I know the science of this inside and out in terms of masks. And I'm wearing what I think will be protective. So I'm sure you'll let me on this plane, because that's the whole point of wearing these masks, right? It's to protect other people and me. And she says, no, you can't wear it. So he says, but you understand that the way that it's around it's fit for me and it's perfect and it will protect against viruses. Nope, you can't wear it. Here's your paper mask. So he takes his mask, and remember, paper mask has all kinds of holes in it all around.
Right.
The virus goes through it. And he said the analogy he gave was basically one human hair can get through the mask any way it wants, basically. And he says the coronavirus is 100 times smaller in diameter than a human hair. So the masks have zero effect on viral particles. And I can tell you, as a neurosurgeon, I wear a mask almost every day of my life, 12, 14 hours in the operating room. But in the operating room, first of all, I'm protected against bacterial infection that I don't want the patient to get, not viral. But B, the setup is such, the temperature is just right, and the HVAC system and so forth is right, where I can tolerate it for a couple of hours. And then as soon as I get out, I got to rip it off. So I can't imagine to have kids or other people wear this for hours on end in an uncontrolled environment. It's pretty scary.
And that's what Dr. Steve Petty said, because I read his brief on that. He said that I think it's called P100 mask, the mask that would protect him, it doesn't protect anyone else. They'd have to have their own mask on, but it would protect him. But what they're offering for everyone to wear is not a protection at all. And yet we have children in a class setting 8 hours a day. And some of these kids who are in after school activities, they're running, they're outside doing activities with masks on, or they're in the cafeteria at the after school little huddle where they go until the parents can pick them up or a bus can take them home till 5 o'clock with masks on. You go in these stores, people are working 8 hours a day with these simple masks on. And I think it's important to distinguish why surgeons wear masks and the difference between you wearing a mask where you are and where they are, because Dr. Petty also said that the HVAC system must be right. It must circulate the proper type of air. And that's not happening on planes. That's not happening at home. It's not happening in the schools. And all of this money that the
not even in hospitals.
No. And the CARES Act has thrown billions of dollars into these schools so that they can renovate, which is not happening. All they're doing basically is mandating masks, vaccines, and social distancing. But they haven't done one thing to improve the schools or the settings, and nor have these large corporations in these jobs. I'd like for you to really distinguish why you're in a mask when, again,
That's
when
a
you're
good
in the
question.
operating room. And the difference between that and the everyday person or a child wearing a mask, because what they've learned, these children haven't learned, they've actually regressed in the school system. They've regressed. And that's mainly because of what you just said about what's happening in the brain. We're seeing more and more children with seizure activities. We're seeing adults with all of these strokes. And then coming out of the stroke, they're masked up. They're in the hospital masked up to recover. It makes no sense to me.
Yeah, Dr. Ealey, I completely agree. The HVAC systems, those are the things that can be modified in terms of the airflow, because we know that these aerosolized particles are so small that they, they're manipulated by the airflow. And so for most of us, it's not an issue when they float up into the sky. And not a big deal, number one. Number two, you're right. In terms of me wearing a mask, it's specifically to avoid bacterial particles, which are much, much larger than a viral particle. But even in that, I can't wear it for long periods of time unless I'm in an environment where it's very cold. The OR is about 68 degrees. The airflow is perfect to be able to wear a mask that long. And as soon as I come out of those doors of the operating room, even in the hallway, I have to take my mask off because I can instantly tell there's a difference in the environment, and that can affect me, can give me headaches, and can cause other problems. And the reason why I started on a journey to help with the masks is I've written some mask waivers, and I have over 2,000 children on tape explaining exactly what the problem was that they were seeing, and the parents. And I'm telling you, some of it, the video footage is just heartbreaking, where the kids would say, "Mom, I don't want to go to school. I'm having headaches. I'm having problems." There have been a lot of, as you mentioned, speech issues where some children were in a speech class. They got up to speed and they put the masks on and they regressed, and now they're paying more money for speech. There were some kids who had problems with respiratory issues. We've had a lot of dermatitis, so they're breaking out. They're having all these problems. And one person I'm thinking about right now, the child had these horrible headaches, went to the pediatrician. The pediatrician checked them out and said, "I don't know why you're having these headaches." The headache started about a year ago with the masks, and a year and a half ago. And that also, then the pediatrician sent that child to a neurologist to try to figure out what was the cause of headaches. But when that child takes the mask off at home, the headaches get better. So my prescription, just like as a neurosurgeon, I'm a surgeon, so I do brain surgery, spine surgery. If there's pressure on a nerve and non-operative care isn't fixing it, my solution is to take it off. Likewise, if you come to me as a neurosurgeon and you say, "I have this mask on and it's causing all these problems," my advice is to do the same thing. Take it off. This is literally a form of child abuse.
Yes.
Okay. It's literally child abuse. And so I am, just like you all are, so proud of the mama bears and daddy bears out there who are standing up for their children and their health. I mean, because literally that's what's happening. It's a form of child abuse when there's no data that shows at all, that shows that the masks help the children or anyone else as far as catching COVID or not. And yet we are seeing more violence. We're seeing more problems in school, poor attention, headaches. I have 2,000 kids that back up the fact that they can't breathe and they have headaches. And my own daughter, what started me on the journey was my daughter early on, about a year or so ago, year and a half ago, started to say, "Hey, Dad, I'm having headaches in school." And then her attention changed. I talked to the teachers, and they were saying something was wrong. And then they would send her to the nurse in my school. And I was trying to figure this out. And then that's how I arrived at these conclusions, is because when she'd come home, you take the mask off, she was fine. And so there's a lot of physiology. There's a lot of science that supports that.
Well, I'm seeing.
Oh, I'm sorry, Sumayyah.
No problem. I'm seeing all of these commercials now that are saying, "Oh, the cloth masks don't work. You need to wear N95 mask. That's what you guys should be wearing." So what they're doing is encouraging people now to switch from the cloth mask, which were already causing these problems, to now wearing N95 mask all the time? Like, what do you have to say? Like, what do you think about that?
So I will tell you it with people like Dr. Petty and other hygienists, industrial hygienists, they create a program around who needs to wear a mask. And for a mask, for it to work correctly, it has to be fitted individually on that person's face. It has to be tested, and you can't have facial hair, and you have to have a mask break every 2 hours or an hour. All those things are supposed to occur, and that's in the workplace. If you will go back and look at all pandemics in history, you will never in one place find, in the pandemic preparedness of OSHA actually, until recently, that masks were ever even discussed to be a generalized solution across the population, because you can't control those variables and you can end up doing more harm than good, let alone whether it even works or not. And so when you have places like here in my state, in Michigan, when you have where you have most of the counties, well, there's a law basically that says masks under the age of 17 is it's against the law to mandate masks under the age of 17. And then you still have a couple of counties who are pushing, and some school boards pushing still for the mask in the children. And then we found out that actually a group of parents and an attorney actually went before the board, and they found out what was really happening, and they tied it to the budget, the PPE budget and the CARES Act budget. And they said, okay, we're going to go after your bonds. We're going to go after the money, because this is not about our kids' safety anymore. This is about money. And so they did, and they won.
It's billions of dollars that it has been allocated to these schools.
Yep.
We were talking earlier, just in Orleans Parish, with a mask mandate, a vaccine mandate for 5-year-olds and up, which hasn't been proven, and a social distance mandate in public schools, they've been already given nearly $300 million. No improvements within the schools, no HVAC system that's up to standard and par in a tropical city. New Orleans is steamy hot. It's like being in a swamp all of the time. And your children are supposed to go into this environment. And I read briefly this study that Stanford and Yale did in Bangladesh, where they proved masks didn't work. All types of masks don't work. And yet here we are with these masks. And you have these governors who have these masks bans, but now what they're saying is, oh, well, if that city wants to do what they want to do, or that district wants to do what it wants to do, let them do what they want to do. If there is no scientific proof that it works, better yet, there is proof that they don't work, and no one should be ingesting their own toxins back into their bodies. How do we get out of this? How do we get children out of this, and adults who really need to work?
Yeah, Dr. Ealey, wonderful points. And I think, I have some suggestions. One of the things that I also see is I see the lone person in a mask in their car or outside wearing a mask, and they wear it religiously, quote unquote. And my concern is the other big issues, not only the fact that the carbon dioxide and the waste affects our children. There's science to prove it. So again, that's child abuse. But also in terms of knowing that a mask does not help, even N95 against the viral particles. The other thing, though, is the social aspect. What we've seen now is there's been more depression, anxiety in children. There's been increased suicide rates. There's been more domestic violence because of the social isolation, because of the distancing. One of the things is there's this study, there are several studies looking at what happens when you hug, appropriate hugs and relationship. And the opposite is true. And you may remember some time ago, if you go back and look at the Time magazine article on the hug that changed medicine. And that was, in a nutshell, 2 preemie twins were born in a hospital up in the Maine area, I believe. And one was thriving, one was not. And the one that was not thriving was getting sicker and sicker and sicker. Her organs were shutting down. and the family was concerned, the nurses were concerned. And so the nurses did something that was in that day very unusual. They knew that with preemies, you shouldn't put them both in the same bassinet because of infection, just like we're talking about now. What did she do? She went ahead and put the two twin daughter or sisters together in the bassinet. And as soon as the one that was thriving got into the bassinet with the one that wasn't and put her arm around her, immediately her vital signs improved and all of those systems that were crashing thrived. And now they are 30-year-old twins and doing well. So the social distancing has a negative effect on our health, emotionally and physically, and based on even that experience from 20 some years ago.
Well, I know
Wow.
that to be true. I'm the mother of twins. And my son was vaccine injured early on, but he was the preemie baby of the two. And so when I brought them home, I put them in the same crib, but I had them at opposite ends. And the first day I put them in that bed, in his weakness, he bobbled his head, turned his body around until he reached her and he could touch her. And I stopped at that moment when I saw that. I said, oh, he needs to be close to her. And it brought him, it just revitalized him. I watched it personally. And when he got his diagnosis of autism, he got it early at 18 months. But I think he was about 4. And I can't remember the psychologist's name in New York. I should remember her name, but I don't. She came out with a study about hugging children diagnosed with autism, the difference that it would make in their lives. Well, I always hugged him. You know, he would lay out like this because he was floppy. He had mitochondrial disease too, and I didn't know at the time. And he just no emotion with him, always seemed as though his brain was on fire and he was hurting. But I made a conscious effort from the beginning, because he was my baby, to hug him, hug him, hug him, hug him. And his dad would hold him so close because we didn't know all of this information. He said, oh, he needs deep pressure. I think he needs pressure. My husband didn't know anything about sensory issues. I didn't either at 2. But we did a whole lot of that. And he's a very affectionate child with empathy, because one thing they tell you, they don't develop empathy. It's not true. It's very affectionate, very loving. He's a touchy-feely 22-year-old. So there is something to that. It just shows that we need each other. And what these masks have done, and a social distancing, has made us afraid to be in the same room with one another. I can walk into a building without my mask on. And if there are people with masks on, they're going to make sure that they step aside from me even further, as though I've got something to plague or something I'm going to give. And I see it over and over again. And I've seen children now who are being diagnosed, 8, 9, and 10-year-olds being diagnosed with bipolar disorder and personality disorders, children who never had these disabilities before, who have been at school with these masks, 6 feet apart, really trained like the military to keep your distance, stay apart, isolate yourself, because some of the desks have cubicles. We're really, as you say, this is a form of child abuse, and it's not just happening on behalf of the parents, it's happening in society. And we've got to do something to bring more attention to this so parents will wake up. These schools are not worth this. Being a part of an organized sporting group that's requiring this is not worth this for your child's mental and physical well-being.
Right.
Right.
And you know what? This is very simple for me, because I remember early on in this pandemic being in Whole Foods, and I had basil, and it was online, and handed the basil to the cashier for him to ring it up. And I've got on a mask, he's got on a mask, and 2, 3 people behind me have on masks. And he says, wow, this basil smells really good. And I'm like, yeah, it does smell really good. And then the people in line were like, yeah, that does smell really good. And I said, well, I wonder what's the difference between a basil particle and the virus, because we all got it. If there's any similarity in size, we
That's
all
right.
got it.
That's right. That's exactly
Yeah.
right. Oh, you're absolutely right. And the other thing is, so if you look in the history, that when you look at in slavery, you look at the times that when slaves came to America, what you'll find was they masked those slaves to take away their identities and to
Yes.
say, you have no face, and I'm going to train you that this, you belong to me and you are not your own. You have no face whatsoever. And so that's one of the pieces. The other piece is from an immunologic standpoint. The natural killer cell is a part of our innate immune system, and it basically has two functions. And this is related to the mask and the social distancing. And it has two functions. Number one, it kills precancer cells. And number two, it kills viruses. And it does that in a non-specific fashion. So in other words, all day long, it trolls your body to kill these intruders in your cells. And so it's an amazing, amazing component of the immune system. Well, we know that when the natural killer cell, when it functions well, all these things happen. But we're finding out a couple of things. For African Americans in particular, and those of color in general, including Hispanics, that vitamin D is one of the issues. When your vitamin D3 levels are low, the natural killer cell function decreases. And we know that roughly 84% of African Americans have very low vitamin D levels, and about 70-some% of Hispanics, because you have to activate the vitamin D. And you have with your complexion, that can be a bit of a challenge. And here in Michigan, we get the second least amount of sun of any other state outside of Washington, Seattle, Washington. And so pretty much every African American is going to have low vitamin D levels, and that's going to affect their natural killer cell, which affects their ability to fight the virus. The other thing that we know is MD Anderson, a major cancer institute, noted early on that when there's laughter, people who have cancer do better. And so not only do they have traditional treatment like radiation, chemotherapy, all the usual treatment, but they have found over and over and over again, unequivocally, that when you add laughter to that mix, that it improves their outcome and quality of life. And so to such a degree that now when you go on their website, you will see laughter yoga as a part of their treatment for cancer. And we also know, last piece is to tie it together, when people have depression, they're more likely to have upper respiratory tract infections, just like the coronavirus or SARS-CoV-2, and they're likely to have poor wound healing, because depression and lack of that social well-being and togetherness affects your natural killer cells and also your stem cells. So these are all completely tied together. And so when you take away a person's face, when you take away the ability to hug, and when you add fear, which is what this is, it's fear mongering, then that's literally going to affect the immune system. And then that's also going to affect people, and they're going to have a worse outcome.
They even
Well,
took
it's
it
so
a step
bad.
further.
Well,
Go
it's so
ahead.
bad. Someone told me the other day that they talked to a student, a 14-year-old student, and she told her, listen, you don't have to wear that mask. Our governor has banned masks in the state, and you don't have to wear that mask. She said, I'm afraid to take it off. I'm afraid of people's faces now.
Mm-hmm.
And by the way, with the fear, that's interesting, Dr. Lee. And with the fear, here's an illustration. I'll give you another illustration that everyone that hears this will immediately know that what we're saying is true. And that is the natural killer cell again. And it's the effect of when there's good laughter. Children laugh about 300 times a day, belly laughs. The average adult over 30, about 10 laughs or less, belly laughs a day. And so you're already a setup for a problem in terms of your social functioning and your having joy, having faith, having that peace in your heart, versus being fearful of getting near someone, catching something dying. But we also know the cold sore. So the cold sore, as you know, it comes from the herpes virus, and it's common, and you're exposed to it. But here's the thing: the cold sore, it only comes out when there is severe stress, or there is severe, you're very tired. That's the only time you have a breakout of cold sores. And that's to say, not for the people who have, autoimmune disorders or other immune system dysfunction, but for the average person. And that is directly related to the natural killer cell. So again, your physical well-being and your emotional well-being and your spiritual well-being are all connected. And one of the things I note in some detail is in my book, thegodprescription.com. And if you go to that website, www.thegodprescription.com, I kind of go into some detail about that because there's some really interesting people that I've met along my journey who've been into some interesting scenarios. And that's one of the things that's brought out.
Well, I've ordered your book. I still haven't received it yet.
Yes, and thank you, and I appreciate it. We changed publishers and different companies, so you will shortly. So thank you very much. I appreciate it.
You're welcome.
Hopefully I got this right, putting it up for the audience. www.godprescription.com.
Yep.
Okay.
Thank
Go
you.
to the website, family.
Please. Well, I find it interesting what you're saying about the killer cells, because at first children were not catching this virus, not at all. But after 18 months of being masked up, now they're saying children are the most vulnerable. They're catching the virus at a high rate. And we're now having problems in these schools with the children catching the virus. But I remember a time when all the children caught the flu and no one shut the school system down.
Right.
And as a girl, when we all caught the chicken pox, mostly it was in the summer, they didn't send us home because a child came to school with the chicken pox. They sent the child home. And the rest of us stayed at school.
Right.
But this is so different and supposedly so deadly. And I've known children who get over it within 3 to 4 days. They're right
Dr.
back to
Ealey,
normal.
I completely agree. So we know when we look at the data, first of all, for all comers, the death rate is about 1.7, 1.8%. When we look at the young adults and children, it plummets to a number that is smaller than the average flu. Kids have an amazing immune system. They have a thymus gland, as you know. When we were little, we ate dirt and we were fine. I mean, we did, all the things that we went through, and nobody batted an eye at all the things that happened to us. And it's because our God-given immune system is so, so powerful. And yet in the media, no one wants to broach how the immune system works and how powerful it is. And it's really the only reason why all of us are alive since we were younger is because our innate immune system and our adaptive immune system is so strong. And so we want to sidestep that conversation. Why? Because we also want to get people to manipulate them to do certain things. And yet we have this strong immune system that has helped us throughout, our whole lives. But for children, yes, we know now with Omicron and some of the other variants, it's more infectious, but it's less virulent. And so that coronavirus now is going to infect everybody, but that really should actually end the pandemic and the endemic now. Because why? Because now everybody has it, just like anything in the flu. And so now all of us have this strong innate immune system, which means, because people misconstrue what that means, like once you get it, you're not going to catch it. So, and as you know, so the virus will always enter us, leave us, and enter us, and bacteria for our entire lives. There are more viruses and bacteria on us and in us than our own cells in our body, first of all. Number two, it's going to enter us, but the thing is, our immune system, after that first exposure, now our adaptive immune system is ready to go, our innate immune system is ready to go. And so now when it comes back, we might have a fever for a day or two, runny nose, what have you, but we won't have as worse symptoms as we had the first time. And that's because our intact immune system is doing what it's supposed to do. And so, more people may catch a cold, but they're not going to get deathly sick, and especially not kids. Actually, the common flu is worse on kids than the coronavirus, even to date. Even if more kids are catching the coronavirus, again, it's still more deadly the flu is still more deadly. So to put our kids through something that's actually going to harm their immune systems, we know that when you go from one of the concerns, and I'm not an anti-vaxxer per se, but I can tell you that my concern is that when I'm not, for me personally, I'm not interested in taking something that I don't know the components.
Right.
And now that we had to go to court to find out what's in some of those components, they initially said, okay, we'll let you know it'll take 75 years to get
Right.
all the information. Now that alone, I'm done. You
Right.
don't have to tell
Yeah.
me anything more about it. You don't have to ask my opinion, anybody else's opinion. If it's going to take you as a company, and I had to sue you to find out initially 75 years, and that's been decreased, but 75 years initially, then I know there's a problem and it's not worth it for my health. So,
Right. So, Dr. Jackson, what do you say to people? Because I've had people say this to me. Samaya, I feel safer with the mask. I know they don't block viruses, but I feel safer wearing them and having my kids wear them. Um, because I don't think they see the harm, or they feel like they're not harming them because they go and come and they're still standing. What are some of the symptoms they should be looking at to know that the masks are doing harm?
yeah. So first of all, you'll see, so the contact dermatitis, the kids you'll have a sinusitis. So you're going to have more sinus pain, sinus headaches. You're going to have more colds. A lot of kids of the 2000 that I have interviewed in families, now they're developing more colds because they're sucking in, as Dr. Ealey said, all of the waste products. So that affects your immune system. The headaches, the acting out. It is not ADHD, okay? All of those things that are the inattention, the poor grades, all of the passing out, the almost passing out, all of those things, all the coughing that's going on now, that's more. All of those things are happening. So to feel safe and to be safe are two different things.
Right.
So now we're talking about an opinion about how I feel, but at the same time, as you had mentioned, what's the damage that's being caused? And I can tell you, it really is a form of child abuse. So to keep your child, one of the things that gets me, and I can tell you, I got picked on when I was in elementary school, and at one point in even in middle school, that fad was to go from the straight jeans to the bell bottoms, and vice versa. Well, one year I walked in, and my mom, single mom, love my mom, she's my hero. We would shop at Kmart to get our clothes, and so we got bell bottoms, but bell bottoms had just gone out. I get to the school, I get teased. A group of kids come around me, and I get teased incessantly to the point that the counselor said, "Hey, Avery, you should probably just go home and change and come back," because it was only about a mile, so I walked and changed. But she understood that the mental and emotional destruction could affect me not only then in my small, my emotions as a youngster, but also affect me throughout my life, right? And likewise, when you put a mask on, you are taking away your identity. You are taking away your child's identity. It's a form of child abuse.
Yes.
And then you get used to being subservient, basically. You're used to someone taking away your identity and your face, and you should be proud of who you are. You were made special. You have a unique gift. And when you also smile at people and they recognize you, that's powerful. And not only for you, but what about all the other people? A smile is not for you. A smile is infectious because it's for everybody else, right? And so we're social beings, and you take away that social, and you're going to have some major problems, both internally in terms of, as we had talked about, in the physical sense, but also emotionally and even spiritually.
I see people masking babies in the store, infants in the store, they're masked up.
Yeah.
And I've heard children saying they don't want to wear the mask, and yet parents are not listening. We're talking about little human beings.
Well, I've seen babies like literally be right after being born with their parents in mask. What's the implications of that?
Yeah.
Like, you're a baby, you come out, and everybody around you, including the medical staff, is in masks. So you don't get to see a face the first days of your life. What's the implications of that?
Yeah, and Simone, that's a great point, because we have something called the social smile. So when we look at milestones in our development, our brain development, connected to our emotional development, they're completely connected. You can't separate them. the first thing that as a neurosurgeon or a pediatric neurologist, and I did a ton of pediatric neurosurgery in my residency, and we would have to understand all these different milestones in children, and then we can say, oh, they're delayed or not. It'll help us with our diagnosis and whether there's a tumor and all of this. The first thing was the social smile early on. So when a child does not have the ability to recognize what is a normal, safe, social environment, the social construct, recognize mom and dad, the children have major problems with brain development and also with social skills. That can affect their brain literally and their emotional states and their confidence. So again, it's destructive. So it's child abuse. When you force a child to wear a mask, especially for these types of scenarios, and even when these kids, I hear more about kids putting their mask on and getting in trouble from the teacher, and then they have to go to the office, the principal's office, because they're a bad child for wanting to breathe. So if me wanting to breathe is a derelict in my responsibility as a child, okay, so then what else can't I do? Because if I can't even breathe on my own, then I guess I can't do anything else. I'm going to always be, be subjected to some form of punishment. I'm going to be ridiculed because I just want to breathe. So that's what's happening with the kids. So when they become children, when you look at the Unabomber, for instance, the Unabomber was an assassin, obviously, here, in America. This gentleman, he was brilliant intellectually, had one of the highest IQs you could imagine, but he had problems socially when he was a child. His dad did not connect with him. He was socially awkward. So what he would do when he became older, he would make these political statements and he'd just blow people up, blow up buildings. It's not that he didn't like people, but they didn't matter. And nor did he matter in his own eyes. And so he was doing that to people. Brilliant, right? So you can imagine now, and that was before they had the masks and saying, you're a bad person because there's a mask. You're not wearing a mask. So what's going to happen in the future to our children and others when they socially, well, I better wear this because other people are going to think I'm weird, or other people are going to, it's going to have a ripple effect that's going to be long lasting. So I would encourage, as Dr. Ealey was saying, what are the things that we can do? I would encourage the mama bears and the papa bears to step up and stand up for their children and stop this child abuse, because it's literally child abuse. There is no scientific reason as it relates to the virus that a mask should be worn at all. But there are about 60 papers that tell you why they shouldn't be worn. And so we also know that there are problems with their emotional states and their emotional development. We know there's brain problems. There's physiologic problems throughout their entire body. So it doesn't make sense to force a child to wear the mask. And likewise, I believe that the mask corrals people into so much fear, then they go and they get the jab out of just fear, not out of any science or anything else. They either want to get this mask ripped off so they're done, so I'll do it, or I'm so fearful that I'll take whatever you tell me is right, whether I know what it's going to do to me or not, I'll go ahead and take that. And I believe that that was also part of this plan to get people to head in that direction. So you might say, all right, well, what about the African Americans who are younger, who went to the hospital and they had problems and they died because of the virus? Number one, I can tell you, I've treated people in the hospital, outside the hospital. If you go to the CDC guidelines, they will tell you there is take your Tylenol or your Motrin until you can't breathe, and then you come to the hospital. Now, in the history of medicine, we as physicians have never done that. When someone has an upper respiratory tract infection that's bad, you go to the doctor, they give you all kinds of medication to knock it out so you're not suffering at home and suffocating at home or throwing up at home. And now they're going to tell you there's no treatment. And we know there's early aggressive treatment that on FLCC and Frontline Docs and others, there are papers that have shown that it helps people within a couple of days, usually if you catch it early on. And then add to that, now, when you do go into the hospital, what happens? One of the things is that I was treating with steroid. I got suspended for 28 days from one of my hospitals because they said that I was interfering with a quote unquote protocol. And listen, it wasn't the Ivor. It was literally just increased steroids. So they were already giving steroid. And we know that there are three parts to this real quickly. Number one, there is the virus. So you want to knock down the viral load. There's a bunch of different ways to do that. And I mentioned those sites. One of the best things you can do is actually betadine. You can take betadine and swish it in the nose and a gargle and spit it out twice a day, and that'll kill most of the virus. And if you don't believe me, you can go to the American Society of Dentistry, and you can see their studies. They've been using it forever. That's why there's never been a major outbreak of COVID at any dental institution in the last 2 years during all this or ever. So that's a quick fix, but that's the first. The second is the aspirin so that people don't develop blood clots that go to the lungs, they have problems breathing. And the last is the steroids to decrease, not steroids, but to decrease the inflammation, the cytokine storm. The lungs get inflamed, and when they get inflamed, they can't absorb oxygen. And in the hospitals, what we're seeing is they're putting them on more oxygen, but they're giving a small amount of steroid because they're concerned that they might develop a superinfection based on some of the CDC guidelines. But the thing is that in Italy, they gave huge amounts of steroid for a couple of days, and they were able to decrease the inflammation in the lungs, so the lungs can now absorb oxygen. So it's like basically taking a cup of water and putting out a house fire in the amount of steroids they're giving to decrease that inflammation versus really opening up a hose, decrease that inflammation, and then now their lungs can take in the oxygen, absorb it, and then you can get on with it. So because they're giving such a small amount, people are left basically just in supportive care. So if you're already in a bad way, you can't breathe anyway, the lungs are inflamed. I don't care how much oxygen you force on a person, no matter what kind of mask or whether it's BiPAP or anything else, you're not going to absorb oxygen and you will die in those instances. So that's a big piece I want to tell you, just to mention.
I think it's important what you're saying because when people think about coronavirus, that's a new name to the general public, but coronaviruses are cold viruses, and they've been around forever. They've been around, but this one has been made to be so different. And the basic treatment is a vaccine for this instead of allowing doctors to do their job. Because I grew up with asthma, bronchitis, you name it, I had it, pneumonia. I just had it. And I would go to the doctor. The first thing they would do is just like what you said, give me comfort, make sure my lungs were open so I could breathe, and steroids. I mean, that's an old traditional way of dealing with this. And yet you were not allowed to do what you need to do as a physician because someone said we got these guidelines.
Right. And basically, it sounds like to me what you're saying, too, is that the practice of medicine, right, to treat the symptoms like, shortness of breath, right, has changed. So they're not treating the symptoms now. You go in there with shortness of breath, they look at you like, well, come back when you're basically, and I've seen that. Like I've literally seen, I know people who died because they were turned away from the hospital several times. And when you go to the hospital and they don't turn you away, the answer is a ventilator.
And by the way, I'll tell you that what things that we found, and when I got suspended for the 28 days, it was for an administrative suspension, because I tell you, I'm good at my trade. I know what I'm talking about, and I can back it up with 10,000 cases. Okay. So, and a lot of those were critical care cases, because a neurosurgeon, you deal with people in the ICU all the time and they're critical, and you have to know about ventilator care. You have to know about all those parts when you're taking your boards to be board certified, which I am. And yet in this scenario, what happens because of that, you have many, many people that may go in, and the ones who are sick may not make it. And there are a couple of reasons why. Number one, if you're African-American or if you're Hispanic and your vitamin D level is low, which it probably is, the natural killer cell function doesn't work. And here's the other thing. The inflammation increases, but guess what vitamin D does? When it's activated and it's at the right level, it actually decreases that inflammatory response. It buffers it. So on both ends, the viral and infectious end, dealing with the virus, and on the other end, the inflammation, vitamin D will do both. It'll help both. And I tell you, it's an interesting thing, especially that it's kind of curious that these two populations in particular happen to have the lower vitamin D because of skin tone, because of melanin. And you will find the normal vitamin D levels should be, and FDA says 29 nanograms, what have you, but really we should probably be up to about 50, and definitely not above 80, but up to 50, up to about 50. So it's interesting that so many people have low vitamin D, and I believe that that's one of the elements in those younger people, because someone might say, well, yeah, if you talk about younger people, this young person went to the hospital and they passed. I wonder what their vitamin D level is, number one. Number two, my big thing is stop the inflammation at all costs, which we do with the early aggressive care. Ivor and all these others medications will destroy the virus, as well as they're also anti-inflammatory. And I'm telling you, some of the mechanisms of these early aggressive treatments is amazing. Like the actual science behind it, it's absolutely amazing. So the goal is stop it before it's a big deal, before you have to get to the point where you can't breathe. But if you have to get to that point, knock down the inflammation and stop the blood clots. And what's happening is, if I'm just going to throw a little bit at you, I'm basically like, okay, oh, well, you're on your own. You may or may not make it. We'll see. If you don't make it, well, I tried, because I did give some steroid, even though it's about 40 times less than you may need. I still did it. So you can't say I didn't do it. So I got my hand slapped. The person that I did treat, who did get the higher dose, made it out of the hospital, wrote a great letter of recommendation, but I still got my hand slapped because I was treating them in a way that wasn't commensurate with a protocol. And here's the thing. You had mentioned earlier about how we're treating people now compared to before. And science, it's all about debate. It's all about different papers and perspectives. Right. And that's how we learn when we want the answer. So to go in and slap somebody's hand when they're just showing you 5 papers or 10 papers that support their position, and you're already doing something, and they're just saying, just do a little bit of more to help this person actually got out of the hospital and is now completely fine. And I still got my hand slapped.
Well, Dr. Jackson, that's interesting what you're saying, because what they're doing is they're neutering doctors.
Yes.
No one size ever fits all, not in medicine. And if you're treating an individual, What does a protocol have to do with an individual? So you try the protocol. That protocol may not work for that individual. You'll know within a few days. You may even know within the next day. Then you have to tailor the treatment. And that's what's missing now. There's a great group of us that are afraid to go to a hospital if we get sick. We don't want to be at a hospital.
And Dr. Ealey, you're absolutely right. And so now what's happening, because of the fact that we're afraid to go to the hospital, the things that we normally would get taken care of, early cancer, cardiac, diabetes, stroke, all of those disease processes that normally we have follow-up and checkups, and before it becomes a problem, we're not doing any of that because we're too afraid. The doctors don't want to take care of you. The patient's too afraid. So then they have a heart attack and die at home. Or they get into the hospital and the cancer is spread everywhere and it's too late because they were fearful to go and get treated. Or a hospital says, hey, did you get tested for this, that, and the other? Or did you get this jab? And if you didn't, I'm not going to treat you. I'm not going to give you a transplant. So you're going to die. Deal with it. That is so beyond anything that we have ever had to do as physicians. And for, like you said, Dr. Ealey, also is the other point is that individuals, there's a bell curve. And there are people that fall outside of that curve. And if you are a thinking, caring physician, which is what your oath was about, you find out what's going on with that individual and you tailor your treatment for that individual. So everyone is not the same, and like we talked about vitamin D levels in African Americans and anyone of a darker complexion, for instance, the Hispanic population, what have you. You don't, it's not one size fits all in any medication. And we all know that. But why now are we losing our licenses? Are we being called quacks when our heart is right to just be able to help people and be thoughtful? And as things occur, look at what's going on and say, well, this works for this person, this doesn't. Let's change over here so that we can decrease the rate of problems. And our hands are getting slapped. And one other thing is we found out that there's certain treatment pathways in a hospital where they actually get more revenue. And that's a whole other discussion. But I'll tell you that I can tell you as a surgeon, though, I've got an interesting perspective because many hospitals get revenue from the operating room. And what they did was they said, because of all these beds that were full, or because of the fact that the nurses left, because they weren't going to take a jab. They said you can't do any elective inpatient surgery. So all my bigger surgeries that help people, now I couldn't do those. So I don't get any revenue, but the hospital didn't get any revenue. So you know what they did? They relied on the CARES Act and said, okay, we're going to change our whole paradigm. And now the way that we're going to get revenue to take care of all the bills is we're going to have to do the COVID-19 billing and increase your CPT codes and ICD-10 codes. And we can up bill if a person has COVID. If they don't have COVID, then our bills are going to stay the same. But how are we going to recover from the fact that we're not seeing all these surgeries over the last this was since September. And so now if you do that, you can bill about $100,000 from the time a person's diagnosed with COVID. They go all the way through, they get remdesivir, which I'm totally against, and I don't think anybody should get that. But all the way through to the point they get to the ICU, they get paid. That's another checkpoint. They get put on the breathing tube, another checkpoint. You get a check for that, and die of COVID, another check for that. So if you go all the way through and you have multiple people going all the way through, you're going to make more revenue off of that specific CPT code. And so it's almost like the hospital's hands are being forced to do that because the surgeries, the big surgeries where they were making money as standard, that shut down for 6 months.
Wow.
The morally bankrupt leaders of those hospitals are doing that because they do not care the ethics and the morality that they should.
And to put this in perspective too, like this is supposed to be, right? They say a novel virus, right? This new thing that came in and nobody knew what to do with it. Yet they set up these protocols and they don't allow doctors who are on the ground treating to go away from those protocols, right? Because if you're on the ground treating, you're likely to be the one to find the answers, but you're not allowed. If you even try something else, you're punished. You're not even allowed to enter the conversation.
You are right. I'm telling you, now you hit the nail on the head. Again, I have respect for everybody. I'm not, but I will tell you, Dr. Fauci has probably never treated a physical person, or at least not currently. Okay, number one. Number two, that's battlefield medicine. And battlefield medicine, just like in neurosurgery, when I see a patient, I know what I've trained to do, but I have to make adjustments based on what I'm seeing in front of me, that person in front of me. And so for me not to be able to do that, like you said, my hands are tied, well, that person's going to die. And so that's what we're going through now is when I talk with this ICU doc, and I was talking about this particular patient, she was on my service, my name was on the chart, and I still got my hand slapped. I'm the attending of note. And I basically said, I think we should do this. Here's my data that backs up what I'm saying. I think it'll help. He said, okay, well, we'll do it one more time, give you this pulse dose, and then we're going to back off and whatever. And I'm going to write in the chart all these things, whatever. The thing that really hurt my heart most was the fact that I would have loved for him to argue with me. Totally fine. And he could have said, Jackson, you're introducing this, and here are the concerns I have. 1, 2, 3, 4. You're wrong. That would have been an okay discussion because we do that all day in medicine, right? But you know what he said? Mm-hmm. He said, he says, this is our agreed upon protocol. Didn't say anything about the patient at all. We didn't have a dialogue about, I'm concerned about what you're recommending because it might hurt the patient or the patient's outcome. Didn't have that conversation at all. That was the last straw for me. I knew something was really wrong when we're not having conversations about patients' outcomes per se and the individual patient. We're talking about protocols and whether you follow them or not. So I said, you know what, that was it for me. So it opened my eyes to say every hospital in America has the exact same protocol, or almost exactly the same, by the way. So best thing you can do right now is to make sure that you do early aggressive treatment and that you don't have to go to the hospital, at least not for COVID.
Wow. So we're running out of time.
When you put it like that, when you put it like that, that's the problem. That is the problem. That parents like myself have had with the medical establishment, me for the last 22 years. When you tell me a vaccine is a one size fits all, you have your protocol, and that it didn't do what I'm seeing that it did to my child. Right. And now we've reached that point in medicine You can't go anywhere. You can't go into even a clinic without them taking your temperature. What does a fever have to do with just COVID?
Right. Right.
You're
We're
taking my
running.
temperature, and I have to be mindful if I feel like coughing to try and suppress that cough while I'm there.
Right.
I mean, it's unbelievable because I
It
don't
is
want to have to
unbelievable.
argue with
Yeah.
folks that I got an allergy. When did a cough equate to COVID or a fever to COVID? And this is the problem that parents like me we have with the vaccine schedule, the immunization schedule for children. I just
Right.
hope that it opens people's eyes to look at the whole picture, not just this one part of it.
Right. We're running out of time, and we could really go on. Dr. Jackson, we do have an answer to that, though. We do an after show on My Black Health. Would you stay a few minutes and so we can continue this discussion?
Yes, ma'am.
Okay, wonderful. So, guys, if you want to see the rest of this discussion, My Black Health on Facebook, on YouTube, Instagram. Dr. Jackson, please tell the audience where they can find you.
So, again, you can go to www.thegotprescription.com. You can go to www.michiganneurosurgicalinstitute.com. It's my website. I'm in Grand Blanc. I have my office number, 810-606-7200.
Thank you so much. We really appreciate you being here, Dr. Jackson.
Thank you. Thanks for
Pleasure.
having me. Thank you.